Hello, ladies and gentlemen. Anum-Brown, Moselle-Margaret is my name, and my presentation will be on government's response to the impact of the COVID-19 pandemic in Ghana using a content analysis. This was my thesis work for the Master of Public Health degree at the Ensign Global College, and these are my co-authors who supervised my work. This is my presentation outline. Since the inception of the COVID-19 pandemic, many lives, health systems, and global economies have been affected. However, in Ghana, over 160,000 confirmed cases, coupled with approximately 1,500 deaths, were reported as of March 2022. The coronavirus outbreak is a historical change. Therefore, there is a need to record government's response for future pandemics. The general objective of the study was to assess government's response to the impacts of the COVID-19 pandemic in Ghana by identifying public health policies that were implemented by the government in response to the impacts of the COVID-19 pandemic, to describe the approaches used by the government, discuss the challenges faced, and to observe the trends in response to the impact of the COVID-19 pandemic in Ghana. Our conceptual framework builds on the influx of the COVID-19 pandemic, which led to a socioeconomic and health impact, influencing government's response, such as the implementation of public health policies, amongst other measures. A case study was used as a study design and a qualitative method as the study method. Our study population made use of the presidential speeches addressed to the nation during the period of the COVID-19 pandemic. Our data collection used secondary data, which were the presidential speeches. A structured question guide, which was informed by literature and our study objectives, was used to form a categorization matrix. Our data analysis, however, made use of a content analysis. The question guide showed our areas of interest, which were used to form themes. The diagram shows sample text which were extracted from the speeches with the use of a question guide to form a categorization matrix. In our findings, 25 speeches were accessible out of 28, and the mode of delivery were through television, radio, and social media live stream. It was also observed that the second to 9 speeches were delivered on weekly basis. However, subsequent speeches were delivered at inconsistent intervals. Public health policies by the government of Ghana addressed the general public, some of which were through travel restrictions. Other policies addressed health facilities, children and schools, workplace, and vaccine deployment. However, the government of Ghana used a multi-sectoral approach by taxing various ministries and public agencies, with examples being given. Some of the challenges faced by the government of Ghana in response to the pandemic include illegal entries across the border, increase in daily number of infections, fear of stigmatization, and embarrassment. The diagram shows Ghana's COVID-19 update from WHO dashboard, indicating the peak periods and the off-peak periods. During the off-peak periods, only one speech was delivered. Relatively more speeches were given during the peak periods. In conclusion, the study finding shows that public health policies addressed to the general public were the most mentioned, representing 100%. This is to say that the government of Ghana used a social approach. However, the government of Ghana also used a multi-sectoral approach by taxing various ministries and public agencies in order to combat the COVID-19 pandemic. Issues on fear and stigmatization were the key challenges. Also, majority of the speeches were given at the initial phase of the pandemic, with less given during the off-peak and peak periods. We recommend that the Ghana Immigration Service should prevent illegal entries in the near future. The government and the Ministry of Health should critically address issues on fear and stigmatization. And lastly, vaccine equity should be promoted for future pandemics. These are my references. Thank you for your attention.